Dr. Famuyiwa from Montgomery Fertility Center, and we have Dr. Hestrin.
Good morning.
Good morning. So Dr. Hestrin provides anesthesia at Montgomery Fertility Center.
I do.
Yes.
And it's always a pleasure to do so.
Correct. So what I want to ask is, what is anesthesia?
It's a good question.
Yeah.
Lots of people wonder about that. Anesthesia is a way of providing a sense or a lack of awareness, a lack of discomfort, basically a semi-degree of unconsciousness during a procedure. We do it routinely for all surgeries, big and small. The anesthesia is proportional to the size of the surgery, the length of the surgery as well. Right.
So the surgery we're doing here is we're collecting eggs. Right? And our cases are usually
short.
Very short. And the patients want to know, am I going to feel that needle? I mean, are you know, what's going on?
Of course, and no one would want to feel that.
Exactly.
For sure. So no, you the answer to the question is the patient will absolutely not feel the discomfort of the needle, will not be aware of the procedure during the procedure, won't feel, won't have any recollection, won't have any nausea, won't have any pain afterwards, and certainly won't be feeling anything during the seizure.
So you're saying that you're going to give me anesthesia, I won't feel anything. Are you putting me to sleep? I mean, how am I going to breathe? You know?
So the answer to that also is yes, you are asleep. You are breathing on your own. However, if there was ever any circumstances in which you weren't breathing on your own, we're fully prepared to augment your breathing. We're all board certified and trained in all types of emergency life-saving procedures. Fortunately, we've never had to implement any of those at this facility, and I expect we never will, but it's always good to be prepared.
Exactly, and that's why we have someone like you here.
Right.
That's why I'm not doing it. Some facilities do their own. I believe
never a good idea.
Yes,
because
never.
we're anesthesiologists, especially trained in managing all aspects of anesthesia and even unforeseen circumstances. Gynecologists, general surgeons, orthopedists, cardiologists don't have that training.
Exactly. So I hear all this noisy machine back here. How do you put me to sleep? What do you check in? How do you know I'm even alive?
So we use very short-acting anesthetics. They work quickly and they wear off pretty quickly as well. We give supplemental doses during the procedure until the procedure is completed. The whole time we're watching on this monitor, we're watching your blood pressure, your heart rate, and your oxygen levels. So we know if you're breathing. We know how deeply you're breathing. If your blood pressure were to go up, we can address that with medication. If it were to go down, we can address that with different medications. The same is true for your heart rate. If your heart rate were to go up for some reason, we can reduce it as needed, and if it were to go slow for some reason, we can speed it up as needed. Again, that's all part of our training.
Yeah. Do I get any oxygen?
You do. That's a really important.
That's
a really important point. You do get supplemental oxygen in what's
how
called a nasal.
it?
It's a nasal cannula.
Okay.
And it looks like this, and it basically are two little prongs that go inside your nose, and these wrap around your ears. It's not uncomfortable at all. You don't even know it's there, but it's giving you supplemental oxygen throughout the entire procedure, just to keep your
And how does this machine help with that?
So this
So you
machine
can tell I'm
has
breathing
what's
with
called
that?
a pulse oximeter built into it. And some people might be aware of pulse oximeters. They make little portable ones that for home use now. They never used to. But the industrial grade
Is that
commercial
little
ones.
thingy over there?
That's this little
Can I put it on?
You sure can and see. So it slips on your finger.
Yeah.
Again, it doesn't hurt at all.
No, it doesn't.
And it shines a little light through your fingernail bed.
Am I alive?
You let's see. I'm not sure. It does take a couple seconds for it to register, and there it is. So we get a waveform tracing. That's this blue line right here.
Yes.
And then that's a numerical value, 100% oxygenation. It doesn't get any better than that.
You mean I have good lungs?
You have great lungs. You're exchanging lots of air. It also includes your heart rate here.
Oh.
Number 62 is telling us what your heart rate is, which is
that a good
nice
number?
And slow.
Bad
it's a
number?
very good number. You must be a marathon runner or something because it's a good low number. but not too low, of course.
Exactly.
And then we have a blood pressure monitoring device that inflates and deflates during the procedure as well, and watches your blood pressure.
Awesome. So what if I ate chewing gum the night, the morning of?
The chewing gum's a no-no. We want you to take everything out of your mouth before the procedure, and we also want you to make sure that you have nothing to eat or drink after midnight the night before. It's really very important that you adhere
Why?
to those principles.
Why can't I have a nice soup?
A nice warm breakfast.
What's going to
beforehand.
happen?
Well, if you were to have food contents in your stomach, there's always a risk, and it's a very real risk, that some of those contents could then be regurgitated back up, essentially vomiting. And that's nothing we want to have during the procedure, not because of the inconvenience, because of your safety. All those stomach contents in the food could potentially go back into your lungs and cause a really bad pneumonia.
And if someone accidentally throws something up and we're deep in the middle of a case,
We have a full suction device here, so
Ah.
we can suction out all that bad stuff if we need to.
Yes.
But again, it's always safer for the
Not to do
patient
that.
not to even get to that point. And the way we
Alright.
prevent that is by having nothing to eat or drink after midnight.
Awesome.
So-
So there you have it. We have Dr. Hestrin. He's been an anesthesiologist for many years.
Now,
He's an
23 of
expert.
them.
Yeah, so I feel safe with him, and I know you will feel safe with him. Thank you so much.
Thank you. Have a good day.
Have a good day.